Well, thank you all for being here. That was a great panel session. If you could reintroduce yourself and kind of give a quick introduction of why you are interested and how you got interested into AMR. Harry, we can start with you.
Yeah, thank you very much. So I started as a clinical laboratory scientist in Ghana, and I was mostly involved in the diagnosis of AMR for a very long time. But again, I noticed firsthand the problems that the diagnosis of AMR in this environment looked like, collecting data on notebooks. So I was motivated by helping to overcome that challenge that existed by developing tools to close that. And I thought at the time, digital tools could be one of the ways to close that gap. So I teamed up with a few colleagues of mine to start developing a digital tool that could just make it easier to diagnose antimicrobial resistance first by identifying this isolate. But fast forward, I then decided that, again, if we develop these tools, we collect the data, what next? How do we turn this data into solving real world problems where we'd start developing tools, right? So I decided that I was going to get an advanced degree, and that got me into my PhD, where I'm currently studying a PhD in bioengineering. And the goal is that I will be able to use the trainings that I have as a PhD, post-PhD, to start developing context-specific precision tools that could then be used to address population-specific needs out of this data that we are collecting, focused on antimicrobial resistance. And in the future, we could then use that to solve other problems in infectious diseases and maybe even cancer, right? So that's, for me, it's how I started all of this, and I'll probably end here.
Kasim?
Yeah, thank you so much for the question. So my name is Kasim. I'm based at the University of Oxford, and I work there as a researcher for a while now. And yeah, so my career in the field of AMR started maybe, 10 years ago or something. I was in Chile because I come from Chile, South America, and AMR was becoming a global problem. But in Chile, we didn't have numbers. We didn't have an estimated prevalence, for example, locally. We didn't know anything about the burden of certain type of infections, for example, bloodstream infections, and how AMR might play a key role in here. So then that's why we started the very first studies locally to try to get numbers, to look at the prevalence of AMR in Santiago, the capital city, but also in other cities to the north and also to the south. Chile is one of the, if not the longest country on earth, so more than 4,000 kilometers, you can imagine. So in the north, we've got some weather conditions, but then in the south is completely different. That applies to pathogens as well. So we employ this status, and then we try to inform the national action plans locally in Chile to say, look, maybe there is a massive or a huge or significant burden for this pathogen antibiotic combination in this area, so we need to take action. And well, since then I've been working on AMR more globally, let's say, so we were part of the AMR Data Challenge, and we decided to develop new modeling techniques in order to spot tiny changes in the growth rate of antimicrobial resistance over time. And why we've done it is because we wanted to warn governments or any other settings where they administer this data to take action. So yeah, that's for me.
Very cool. Katherine?
Sure. Thanks again for having us on the panel. And my name is Katherine Perez, and I am a Senior Director and the Infectious Disease Surveillance Lead at Pfizer. I lead the Atlas program, which is really Pfizer's flagship antimicrobial resistance surveillance system or platform globally. And I've been privileged to have overseen this program for about 3 years, and also been working very closely with Vivli with Vivli's AMR register and on these data challenges. I'm a infectious disease trained pharmacist by background. I've done a whole lot of antimicrobial stewardship in the past, and so I certainly am very passionate about understanding the data and the AMR ecosystem because I've seen it firsthand when you have a patient and just have zero options to treat them. And I recognize the urgency, and certainly from a global perspective, it's far more daunting. So I'm excited to keep collaborating with researchers and with the different organizations, and hopefully continue to develop new strategies to combat AMR.
Is very interesting. I didn't, until you guys kind of give a little bit more of your background, I didn't realize that the AMR research seems to be very community-driven, mission-focused. For instance, yours started in Ghana, and now you've kind of grown, and you're now a student at Northeastern. Yours started in Chile as the local community, and it's really based on you guys wanting to help your local communities, and you guys have grown your careers and your research into kind of a global platform.
Right.
And so I think that's pretty amazing. You guys are at different stages in your careers, but you guys are kind of following a similar common path based on kind of your interests and kind of the global reach that
Right.
since you guys are collecting global data is kind of allowing them to do that. So I think that's kind of cool that you guys have a common through line in your paths. So for the AMR data challenge, one of the focuses is kind of on the teamwork. Mm-hmm. And so science is kind of a team project on a lot of the projects, and the scientific questions kind of needs different perspectives. And so would you guys maybe comment or maybe discuss kind of how you approached kind of creating the team, or what you guys enjoyed about kind of that aspect of the data challenge?
Yeah, maybe I'll give a shot at this. But yeah, for me, at heart, I'm somebody who is very collaborative, and I love to work in a team. And I think that almost all my supervisors has told me that, Harry, you are a team great player. You are really good at playing in a team, and I also love to build teams. So as I gave my origin story, I highlight that I used to work on this before I moved to start my PhD here in the state. I did start working on this project with a team of young people who were very excited and wanted to solve problems, because we had this strong entrepreneurial drive back in Ghana among the youth. And I realized that I was somebody who could just attract people to work on problems. Whether it was health or anything along the innovation lines, I was able to do that. So I put them together, and we started thinking of how we could address this need. But again, I was faced with that challenge when I had to move to the States. Time differences could not allow us to effectively collaborate. But when I came to Northeastern, I also realized that it's had a really strong innovation ecosystem where students can be entrepreneurial and daring. So I was fortunate enough to meet one amazing friend who is also a PhD student in the bioengineering department. So we started conversing and realized that we shared similar interests. And it was at that point that we started talking about our project and all of that. And I pitched to him the AMR project I was working on, and he had really smart guy. He had a CS background, though he's an engineer. He went to med school and eventually decided to quit and get into research and do bioengineering research, right? So that is how we started communicating. And from there, he says, somebody who also was at Northeastern, and that was how we formed a team. And I met one other colleague of mine who I knew back in Ghana. We went to college. The guy read the same program, but he was also doing his PhD here in the States. And I thought that we had complementary skill sets that was important for us to continue working on the project that I had started. And that was how we started working together and submitted an expression of interest to the Vivli Data Challenge. And again, I believed as the person who was leading the team that, again, if this was going to be done, I needed really amazing, smart people who can contribute equally to what we were doing, and I was able to spot all of that. We had challenging times as a team. I must say on record right now that there was a time that we were even going to say we were not going to submit a challenge because it was just hard to manage all our time conflicts and schedules and stuff like that. But I knew we were going to win for some reason, so I had to push the team that we need to get this done. Just spend some 2 hours of your time every day and work on the project, and that was how we were able to finish and submit the project. So for me, that is how I engage in team building. Thank you.
Yeah, well, thank you for the question again. But in my case, I think we didn't expect to win the big prize, let's say, by, well, last year, or I don't remember the exact year now, but the whole experience was about how to gather nice people coming from different fields in order to run a project that we are highly interested into that. So, and in that sense, we managed to recruit people from different faculties, departments, and with different expertises. In our case, for example, we had Sam, a microbiologist, we had David Smith, a mathematical modeler, we had Nam Nguyen from Vietnam, actually, so having a global perspective of the situation as well. He's a pharmacist, and also Koen Pauwels, well, from the Netherlands. So all the people were basically from different countries, so they could provide their insights of how we can apply our models or methods to the AMR scope, but also taking into consideration what's happening in their particular contexts. Koen Pauwels is a health economist, and myself, I studied engineering, and then I mutated like bacteria do. And I moved on to health economics as well for a master's, and finally a PhD in infectious diseases in the UK. So that was a very rich experience, because when it came to decide, for example, which antibiotics we were going to analyze to compute the resistance metric, we had the input from the microbiologists, but also the pharmacists, and they were saying, no, these are first or second line antibiotics. And how you define first or second line is going to depend on the country where you're based in, right? Yeah. So then having those inputs was extremely relevant for our project. And although we didn't expect to win, I think given the whole nice dynamic that we had as a team, we made it finally to the final stage.
Katherine, what's your perspective as a judge as you read through some of the reports and as you listen to some of the finalist presentations? They present them as teams, and so kind of how do you take that in from a judge perspective?
Well, it's excuse me. It was surprising. I'll be very honest. Coming from a clinical background, you know, when we take care of patients, it's always a multidisciplinary team, right? You have someone who's doing dietary, someone who's doing the pulmonary stuff, So you've got all of these different roles, and really kind of taking a step back out of the clinical space, looking at just a data set that still affects, patient care at the end of the day, right? But, looking at some of the members of these teams, like economist, I'm like, what? And then I'm like, but this, it makes so much sense, right? Because we're talking about a public health threat at this point. It's not necessarily a patient in a bed, but it is, right, in a different sort of context. I was really impressed by having so many bioinformatics specialists, having engineers. Truly, when I was stunned at how few clinicians, frankly, were involved in some of these submissions, and how much really we can outsource some of these problems to people who maybe think about things in more methodical ways or in more systems-based and take more systems-based approaches than we do traditionally in the clinical space. Again, I think it's just a matter of relaying the concept. And then if you become interested in it, that's fabulous, right? But just like the COVID modeling, right? It's the same to do the AMR modeling, and I think that is just a huge disconnect that programs and data challenges like this are certainly working to fill in those silos, or to cut down those silos, I should say. And it was really very kind of humbling and nice to see.
From after being kind of awarded the student prize and the grand prize, how has the data challenge and the research that you've done for it kind of impacted your career, or kind of the opportunities that you've had because of either the collaborations that you built, because Harry, it sounds like you were able to kind of meet more people and kind of build through your leadership and your magnetism, build kind of that network and relationships. And so I'm kind of wondering have you guys seen kind of lasting impacts?
Yeah, I think that for me, again, the benefits of just winning the data challenge continues to grow by the day. Even now, I still get people who repose confidence in me because of just that singular award. And also establishing me as an independent researcher, because we went ahead to publish this, right? And I became like a corresponding author for the first time, though I had several other publications, but it wasn't that. I was a corresponding author. And I mean, it may not be as a significant kind of a contribution in peer-reviewed journal, but the goal was to get it into a peer-reviewed journal. It's open access, given that I personally believe in that whole idea of open, sharing things in the open. But it does give me that confidence that I'm up to something that is great. I just need to keep my heads up. And again, beyond that, just I look around today and I realize that I'm probably one of the youngest in the room with like industry leaders. I would never have been in such a space or a room without this challenge, right? So it brings me much joy. Also, like just thinking back to where I have come from till now, I think just challenges like this give me the lamplight to shine and to get people to see that, okay, that's young boy from a certain community with a lot of disadvantages, but has been able to make it this far. I think that just winning this challenge just gets me the platform to tell my story.
Absolutely. Kasim?
Well, yeah, similarly. So we had the opportunity after having the award to present our research for the ESCMID conference, which is a conference that took place in Vienna this year, early this year, as far as I remember. And we presented this research, and it was very well received. So we received loads of comments, positive, most of them. So we have been collaborating with a lot of people, let's say, from different countries and also different sectors after this. And we are thinking about how to automate these models and how potentially hospital settings or maybe other institutions can adopt them locally. Another important thing is that we deliver a seminar for the NIH here locally on, again, how to use these models, how to recycle data, which was very well received. And also, well, I've been invited as a speaker to several other venues where we've been able to communicate what the model is doing, how they can use this code, because it's available for free, open source on GitHub, and you can also find it on the website of the Vivli. So in that sense, I think this platform, the Vivli as a challenge, open up several doors, and we are happy for that, and still we want to expand this further in the future.
Very cool.
That is really cool. That's very neat.
Katherine, how does it make you feel knowing that the Pfizer data set, which was collected for regulatory reasons, with not for the goal of doing a data challenge, has been not only used to kind of advance science and produce kind of, allowed them to produce the research that they've produced, but also had such a major impact on their lives and kind of their careers. Like,
Oh, there's no words to describe the privilege that I feel and the humility that it gives me. You know, obviously Atlas has been around for a very long time, and I by no means built it to where it is now. But I'm just so glad that in the role that I have at Pfizer, that I am able to advocate and promote continuous use of the data, to continue to really advocate to have the data available publicly, and to support Vivli's data AMR challenge and the AMR register. I know, you know, personally and professionally, I'm very passionate about this, and I look at all of these ideas, and you know, you can't help but think, okay, maybe we could do this, or maybe we could do that, you know, or we could partner with them on this or that, and I certainly, you know, hope that we're able to do something like that. And as with everything, you know, things take time, particularly when you have compliance and regulatory challenges. But I'm very optimistic, and I'm pretty persistent. So I feel fairly confident that I can likely, you know, forge, you know, support in some way to our researchers and to our data challenge winners, because the work that they've produced has just been really, really tremendous, and has addressed so many different aspects of AMR with very creative solutions. I mean, the use of social determinants, you know, use of climate change or pollution. I mean, these things that, yeah, I mean, it has to be part of the story. And so it's really interesting to see how those data elements are being incorporated.
we've heard a couple of times kind of discussing wanting to use the data and do research for LMICs, for maybe creating a tool for healthcare professionals and some different populations. And so kind of going to that a little bit, your research team can only be so big. You can only have so many collaborators while managing that time. And so maybe the question is, how can we do research for the community and not on the community, but also kind of maintaining, being able to actually do the work. And so this is more in like the global context of if you're a researcher in one country and you're trying to work with and conduct research for LMIC countries, how can you do that research with them and for them instead of on them?
That's a really interesting question. Again, I have touched that scope of work before, but on a different topic, mostly around how can we create access for tools for conducting research. And one of the ways that we were doing that, again, those were projects that were, catalyzed from partners in the University of Cambridge, for example, and they identified partners in Ghana and then or elsewhere on the continent that they saw a need and they understood that those local researchers needed exactly the things that they were going to do. So that, again, identifying local researchers and their needs and finding out whether they were interested in what the projects they were catalyzing just made it easier to get off the ground. But if you take it back to my work with antimicrobial resistance, one of the things that I've been excited about was the citizen science approach to developing projects that was using and working with the community. So can you integrate community members as samplers, for example? Can we collect wastewater samples as a means of understanding the problem of antimicrobial resistance. So, and those were projects that we had developed through my startup company, which I was a little bit silent on. But those were some of the ways that we try to include the community at the center of some of the projects that we do, and rethinking about antimicrobial resistance from a different perspective. So I would say those are some examples of how we try to include the community in antimicrobial resistance, and how we can, with time, feedback the results of what we get out of those small projects that we designed to them, so they don't feel left out in the whole fight towards antimicrobial resistance. Thank you.
Yeah, well, in my case, I think it's been, well, similar again. We've been approached by different people from different disciplines, from different countries as well, and they wanted to learn a bit more from our modules. So then we've had meetings with them, online meetings. Some of those have been face-to-face. And we just bring the tools to them and they can use them. So basically what I'm trying to say here is that we empower the communities, people in the hospitals, for example, people within organizations to use these methods because they are open source and they're freely available. So we are happy to collaborate with them, not for a monetary purpose, but rather for a population health sort of like a mission here. And as long as these methods can be useful, then we're happy to collaborate with them and to teach how to use them and to guide them potentially, and especially when it's crucial for the early detection of pandemics such as the COVID that just happened. So yeah, but that's the main message here. So we're trying to empower people. They can use this method. For us, the Vivli challenge was more like a proof of concept for applying certain techniques. But then nowadays we see it more as a tool for empowering people to use them and to identify things that we cannot observe if we just looked at the prevalence of AMR as it is.
Yeah, I would actually, it's sort of a different kind of answer, but I think that there's a lot of work that could be done with standardization with respect to the way certain data elements are collected, right? How, if we had consistent documentation or consistent definitions for certain things globally, then we could normalize some of the data, right? We could understand that, hey, maybe there's higher rates, maybe there's a perception of higher rates of AMR in a certain region, but it's because that region is, is underserved and they can only take blood cultures when it's someone who's really sick, versus a region where they do blood cultures in everyone, right? And so if we're able to sort of normalize the criteria, or not maybe the criteria, but the definitions of what's available, if we can standardize those things, then we might have the ability to normalize and be able to really kind of capture the caveats of what AMR looks like globally without just going into a community and saying, we want to test you for AMR kind of thing, and then that could be more sustainable as well, right? Because otherwise you may just have an initiative, but an initiative that lasts 2 years, but then once they're gone, then what, right? If we can have framework and again, really standardized definitions of access and of different laboratory tests and diagnostics and antibiotic use, then I think we could really start to compare things a little bit more apples to apples as opposed to apples to oranges, which is a lot of where we are right now.
Thank you. I'm now going to challenge you all to, as we kind of close out the session, to give you the opportunity in kind of one sentence. What would you like to tell the community? And so feel free to summarize, but kind of your last ending final sentence on your statements.
I think that there's still a lot of work that needs to be done. Of course, databases like Atlas, as well as the registry we have with Vivli, has definitely opened up a playing field to try and solve the problem of antimicrobial resistance. And again, I think that from a low and middle income perspective, there is still a lot of work that needs to be done in collecting data to make it easier to understand globally the problem of antimicrobial resistance, and even in those environments. So we definitely need a lot of work in that area. So collaboration would probably be one of the ways to make that happen. So that would be my parting words to this conversation. Thank you.
Yeah. Well, in my case, I think under this unprecedented times, just because of, political issues, global issues, climate change, and so many others, I think initiatives such as the Vivli Challenge are extremely good because it allows you to team up with people to try to come up with good techniques or good innovations, let's say, in the AMR field. And maybe if you're lucky enough or you have got the skills enough, you can solve and tackle a massive challenge as AMR is.
And I would say infectious disease really can't be siloed. Antimicrobial resistance crosses barriers across countries, but also across disease states. And you're going to see it in any therapeutic area. And we can't put our heads in the sand and deprioritize it from a research and development perspective. I think these data challenges further highlight, use cases for AMR, for R&D solutions to AMR, and I would really highlight the fact that we can't have modern medicine without antibiotics.